What's with all the deaths? It can seem like in the last few weeks, we've been racing ahead of the whole world in deaths. The COVID infection rate is one, and that's not really what is scary. A lot of people aren't very afraid of the COVID infection rates because viruses we know and viruses we can take, but when you're seeing people dying at the rate we're seeing people dying now, and you're seeing younger and younger people, you're seeing people that are seeming more and more healthy and they are dying too, that seems a bit scary. And it seems, to me at least, it seems to go contrary to the kind of idea we were given about the virus in the earlies, or at least the idea that some people gave about the virus, about how rare deaths were with it. And judging from the amount of infections we're seeing compared to the amount of deaths we're seeing, it seems like something is really off. But we could actually check. If we go to the Statista website, we can check the COVID statistics and see where we rank in the world. At first, we can pull up the deaths per million in total. This is since the virus began, the deaths per million and the countries that suffered the most. I have the top 13 up here. And let's check for the top 10, the amount of countries, or the number of countries rather, within the Americas, within our region. It was just Brazil. It's only Brazil there. And when you're going through the entire 13, at number 12, we have Peru. So our side of the world, in the grand scheme of things, wasn't doing too bad. It can nearly seem like we had some of the COVID measures down. And in the earlies, at least in within the last year, Trinidad was at one point number one in the world in our COVID response. We were doing really well. We were getting praises from all over the world. But when we switch it now to the deaths within the last 7 days, the deaths per million for the last 7 days. And now we look at the top 10. Just in case you're listening and aren't looking at the moment, the top 10, going through the top 10, starts with Uruguay, Argentina, Paraguay, Colombia, Trinidad, and Tobago. We're placed there right at number 5 in the world in deaths per million within the last 7 days. That's a spot that we don't want to be. That's not a top 10, that's not a top 5 that we want to be in. But regrettably, we are in it. And below us, we are actually higher than Brazil, who was number 9 in the world. But we're ahead of them now within the last 7 days. To close out the top 10, we have Brazil, Peru, Croatia, Nepal, Hungary. 7 of the top 10 countries in deaths per million were from the Americas region. That's something that is very notable, and that's something that is scary, and the reason for it is something that we have to try and get behind, that we have to try and get beneath. We need to know, why are so many people dying in our region from this disease? And when we check in cases per million, these are the number of infections per million that are going on, the number of new infections that occur per million. We're seeing that we're in the top 10 there also. But the other countries within the Americas, we are almost all of those that are high within the deaths per million are also high within the total confirmed cases per million. But we're still lower than the Maldives and Bahrain and Sweden. When you combine those pieces of data, it could seem like the death per infection ratio is also higher within our regions. And that is another piece of news that would be alarming if true. Hey, liking the content? Well, like the content. Well, you may not necessarily like this because the news may not necessarily be news that you'd always like all the time, but do you appreciate this? If you appreciate it, give a comment, increase the engagement on the video, which would increase the spread and increase the reach on YouTube. Share it so that some other people may be able to see it. Subscribe to see when new videos are coming out, and click the notification bell too. I'm trying to do some different content where we speak about regional and international affairs and events and see how it all relates to us. And then I speak generally about things that interest me and things that affect me. If you think you'd be interested in hearing some of that, subscribe. At the top of the list in the deaths per million within the last 7 days is Uruguay. And I think it may be interesting to see what is going on in Uruguay and to see if it has or bears any relation to what is going on here in Trinidad and Tobago also. From hero to zero, Uruguay's coronavirus boomerang. Battling the world's highest coronavirus infection rate as ambulances queue to deposit patients at hospitals bulging at the seams, Uruguay has gone from a shining example of COVID-19 control to a nation in pandemic crisis. That sounds disturbingly familiar. Last June, the government was toying with the idea of declaring Uruguay COVID-19 free after several days without any new infections. The country of 3.5 million seemed an oasis in a world turned upside down by the worst pandemic in a century. Fast forward to 2021 and the picture could not be more different. Uruguay, similar to us, was a beacon of COVID-19 success last year. And they seem to have this all under control, and they seem to be an example for the rest of the world. But something, again similar to us, something happened within the last few weeks, within the last couple of months, recently, that seemed to have spiked not only their cases, but spiked the number of deaths they're getting too. There are multiple theories as to what is causing this and what is driving this. One of the preeminent ones, one of the foremost ones, is that they have been the victim of their own success. In September last year, the BMJ Medical Journal declared Uruguay is winning against COVID-19. It partly credited quick action by the government to temporarily close shopping malls, bars and schools, as well as the nearly 1,000 kilometer, 620-mile border with Brazil. So what went wrong? Overconfidence and a loss of risk awareness were the two main factors that caused Uruguay to lose its best-in-class status. Virologist Santiago Marazzo of the University of the Republic told AFP. That seems to be the general consensus, or the general idea that many people are positing in Trinidad also, that it may have been some complacency that led to this renewed spike that we're facing. I agree with that, and that seems obvious, that seems sure, but there's still something that seems like it's creating an increased spike and is affecting us peculiarly more than some other nations, because I don't think that we were necessarily leading the world in complacency. That maybe, okay, as countries like us and Uruguay were leading the world in our COVID-19 efforts, I don't think necessarily that our complacency grew to such a grave level that it was much more and went surpassing that of other parts in the world. A major contributor to Uruguay's fast-spreading outbreak has been its proximity to northern neighbor Brazil, which has been battered for months by a new infection wave fueled by a new virus variant, P1, deemed more contagious. In the capital Montevideo, some 400 kilometers from the nearest border point, some 60% of infections are now with the P1 variant. I do not know this because I do not know the data on it, but I think some of this may be the answer as to what seems to be driving the ferocious infection and increased death rate within the Americas. Because I don't think that the only factor is just that these people, that us on this side of the world, were just so much more complacent and became so much more complacent within the last few weeks. All of this is coming on the backs of the fact that our region, the Pan-American region, has only 3% of it fully vaccinated against COVID-19. And this was the complaint being raised by the PAHO director. PAHO is the Pan-American Health Organization. They're in charge of the running of the health services and the regional health services within our region. The director, Carissa F. Etienne, today called for closing the glaring gaps in access to COVID-19 vaccines in Latin America and the Caribbean by relying less on imports and more on expanded regional production of medical products, including vaccine. And it seems like every day there's some new person begging on the international scene that the lack of vaccination within some of these less fortunate regions, within some of these smaller regions, is a problem. And one of the solutions that PAHO is encouraging and trying to push towards is that we as a region up our ability to produce the things that we need, up our ability to produce the raw material and to produce the precursor materials that is needed for the production of vaccines and other medical equipment. Expanding our regional capacity to manufacture strategic medical supplies, especially vaccines, is a must, both for our people and as a matter of health security, she told journalists at her weekly media briefing. And if what she's asking for is for the Caribbean region to really get to dip into our bag and pull out what we know, to pull out the indigenous abilities we have to produce medical equipment and medical supplies, then she got her answer in Guyana, where a recovered COVID victim, he praised the bush medicine that he had and that he concocted and that he and his family came up with, and he praised that as really being a mainstay part of his recovery. They were giving us vitamin C tablets with some multivitamins, and apart from that, we were taking our own herbal medicine. I believe that the herbal medicine really played a big role in our recovery. I get malaria and dengue in the past, but I never feel as sick as COVID made me feel. Okay, that's an interesting piece there. malaria and dengue, and he still found that COVID was worse than that. That's an interesting piece. Anyway, we started using the fever grass and we mixed it along with garlic and ginger and lime. We boil it in 2 liters of water and the whole family drink that. We also blend like pawpaw leaves and had that or the leaves of another plant called vervine, which is commonly known as the rat tail bush. Our family boiled the different kinds of herb drinks and brought it for us. They are all really bitter. Each one of them have a bitter flavor. We also use the wild Cariella bush that was boiled together with lime. We didn't drink them all on the same day. As we get them, we drink them. The fever grass one with the ginger, we drink that like quarter of the sanitary cup 4 times a day, Domingo said. He initially began drinking the concoction following his second positive COVID test. Doctors, he said, did not try to prevent them from taking the concoction as they were eager for anything that would work. So maybe a partnership could be built there between Pajo and this gentleman, one Mr. Domingo, and he was very willing to give up his secret recipes, unlike the rest of the corporate pharmaceutical companies who are still fighting tooth and nail to not give up their patents, and because obviously they're just worried about the dangers that it would create, and they're worried about the world, and they would provide this vaccine at a cheap price, so you don't need to produce it. This man got his own concoction with his lemongrass, fever grass, rat tail bush with pawpaw leaves and Cariella leaves, and he was willing to give everyone that wanted to see the entire ingredients so that he can help them too. Maybe some research needs to be done into that. I believe many of the people who are currently suspicious of the vaccine, if we were to mix up a concoction of local herbs and spices, of some grasses outside and some herbs and some roots, and boil it in water and give some of them it to drink, they would drink that and be more trustful of that than the vaccine. And I think that shows that there's some lack of trust and communication somewhere in between there. The communication lines between some of the authorities and the people that they intend to communicate with have been broken down, and there's a lack of trust there now, where someone might be able to take quarter sanitary cup of some green liquid in a container, and they would drink that with more trust than what is being said to be tested over and over by multiple researchers and scientists across the entire world. That shows that whoever the marketing team, as it were, was that was trying to convince people of it did a poor job. And this wasn't only my view, this was the view of a communication specialist. The government has defaulted to a colonial style of communicating in which the population is told to do as I say and not as I do. This was the view of Denise Deming, lead consultant of Deming Communications, when Newsday spoke to her in a phone interview on Wednesday. What we have to remember is people do what you do. They forget what you say. It's also about how you make them feel. If I feel like I'm a part of this, I will do what I am supposed to do. If I don't, then to hell with you. Does the public trust that the communication is open, honest, transparent, and true? What we have done is we take the approach, and this sounds terrible, but it comes from a colonial past. I can instruct you, but we've forgotten that we can't instruct people into behavior change just like that. And this is what I've been saying over and over and over. I'm pretty sure I probably made 2 contemplations with reference to this. Okay, some people may have the wrong mindset. We're not arguing whether their mindset is correct or wrong. But if what you're saying is you're trying to change these people's mindsets, there are ways that you can change people's mindsets, and there are ways that you just cannot change people's mindsets. And if you want to go down the authoritarian path and the dictatorship style part where you just make people do what you want them to do, well, okay, that's one way to do it. I'm not sure how pleasant that is going to last for everyone in the long-term sense, but if we're trying to do it under liberal practices, under the republic democratic practices that we have in our country, then what we're trying to do is convince these people and hone into all your marketing and communication skills to actually change someone's mind to what you think and what you say is better for them and the entire country. I think through this crisis, the people who you can see the real purpose of their job are the marketing consultants. Because if the health professionals consulted with some marketing consultants somewhere around February last year and they got a whole handle on this entire thing, by now I think we may have been out of this crisis. And if we look over at our neighbors in Grenada and the situation they're going through, Grenada is going through the situation, Antigua is going through the situation, St. Vincent is going through the situation. The video I did yesterday spoke about how Antigua may have to donate some of their vaccines because their citizens may not want it. I did a video previously on how St. Vincent may have to donate some of them too, and Grenada is also going through some trouble to get even their health staff to take the vaccines. And the staff is saying they're relaying some of the blame, a lot of the blame, into the communication and information dispersal methods. A senior nurse defends reluctance to take COVID-19 vaccine. A senior nurse at Grenada's main hospital is blaming the lack of information from the authorities at the St. George's General Hospital for the reluctance of nurses and other healthcare workers to take the AstraZeneca vaccine in the fight against the deadly coronavirus. There was no education of healthcare workers with respect to the vaccine in terms of coming to the hospital and educating us on such vaccine. I can't even tell you if you asked me about the vaccine, to be honest with you. All they're doing is just forcing this vaccine down people's throat, or I guess into people's arms. And the truth is that a lot of the information has been out there, and the truth is that many health officials have been dispersing this information, but they've been doing it obviously in a manner that isn't reaching to the citizenry, that isn't reaching to the population, that isn't convincing anyone. I think that something must change. Okay, some people say they're big people, you're big and you have to have sense. Well, okay, you can leave them like that, and then we'd all fight to get our country vaccinated, and we'd be fighting for herd immunity for the next how much ever years. But if we're saying that what we're aiming for is to vaccinate everyone, then I think the style of information, the style of communication, how we reach to people, how we reach to try to convince people and change their minds needs to be tweaked a little bit. You agree? Tell me in the comments, and see you in the next video.
Say not innocent thing, not in their games. Success is all you see.